San Francisco is often seen as one of the richest and most technologically advanced cities in the world, yet it also faces one of America's most visible homelessness crises. Thousands of people live in shelters, temporary housing, tents, RVs, or on the streets throughout the city. Areas like the Tenderloin, Soma, and parts of downtown have become widely associated with homelessness, addiction, and mental health struggles. According to California state data, San Francisco recorded around 8,323 people experiencing homelessness in 2024, with more than 4,300 living unsheltered outdoors. Why is homelessness so severe in San Francisco? Extremely high housing costs. San Francisco has some of the highest rent and housing prices in the United States. Many residents struggle to afford apartments even with full-time jobs. Rising rent prices, combined with limited housing supply, push low-income residents into homelessness. Mental health and addiction. A large portion of the homeless population struggles with severe mental illness, drug addiction, or both. Reports indicate San Francisco shelters often serve people with extremely complex medical and behavioral needs. Lack of affordable housing. Although the city has expanded supportive housing and shelters, demand still exceeds available space. San Francisco reportedly has more homeless housing per capita than many major cities, but homelessness remains highly visible because the crisis is so large. Tent encampments and street conditions. Tent encampments became especially common during and after the COVID-19 pandemic. In recent years, city officials increased enforcement, shelter capacity, and outreach efforts. Recent reports show tent numbers have declined significantly since 2024. Some city data claims tent counts reached their lowest levels since tracking began in 2018. However, many advocates argue that fewer tents do not necessarily mean fewer homeless people. Some individuals may move between neighborhoods, vehicles, shelters, or temporary locations instead of obtaining permanent housing. Government spending and debate. San Francisco spends hundreds of millions of dollars each year on homelessness programs, including shelters, permanent supportive housing, mental health services, addiction treatment, outreach teams, food and emergency support. Despite this large spending, critics argue that the city has not achieved enough visible improvement. Public debates continue over encampment sweeps, drug policy, harm reduction versus strict recovery programs, mandatory treatment, housing-first strategies. Some city officials now support more drug-free housing programs, while medical organizations warn against policies that could punish relapse or reduce access to housing. Behind the statistics are real people struggling with poverty, trauma, mental illness, or addiction. Many live in small single-room occupancy hotels, SROs, shelters, or temporary programs while trying to rebuild their lives. A recent documentary called Home is a Hotel explored the lives of residents living in tiny SRO rooms in San Francisco because of the city's housing shortage. Homelessness remains one of the most discussed issues in San Francisco politics. Residents are divided. Some believe stronger law enforcement and encampment removals are necessary. Others argue the city needs more affordable housing and health care instead of punishment. Recent polls show many residents believe conditions have slightly improved under newer city policies, though homelessness is still viewed as a major problem. The homelessness crisis in San Francisco is caused by a combination of expensive housing, economic inequality, mental illness, addiction, and limited affordable housing supply. While the city has invested heavily in shelters and services, solving the problem remains extremely difficult. San Francisco represents a major example of how even wealthy modern cities can struggle with housing and social support systems when living costs rise faster than ordinary people can afford. San Francisco has become one of the most discussed cities in America regarding the connection between homelessness, drug addiction, and mental health problems. Areas such as the Tenderloin and parts of Soma are widely known for visible street homelessness, open drug use, and overdose emergencies. The crisis worsened during the rise of fentanyl, a powerful synthetic opioid responsible for thousands of overdose deaths across the United States. In San Francisco, fentanyl addiction has heavily affected homeless communities and public spaces. CDC.gov. The connection between homelessness and drugs. Not every homeless person uses drugs, and not every drug addict is homeless. However, addiction and homelessness often reinforce each other. Drug addiction can lead to loss of employment, family breakdown, financial collapse, mental health decline, eviction, and homelessness. At the same time, living on the streets can worsen addiction because people face trauma, stress, violence, isolation, limited healthcare access. Many experts describe this as a cycle that becomes very difficult to escape.